Hi everybody, welcome to Daily Dental Hygiene, and today is the official video that I am going to be talking about my thumb splints. So I've showed these a lot on my Instagram. I've talked about the importance of having hypermobile joints and why you need to wear thumb splints when doing dentistry to prevent things like tendonitis, carpal tunnel, and a lot of just finger and thumb problems and the longevity of our career. So protecting the longevity of our career. A lot of you don't know this or maybe have never been told, but hyperextendable joints, hypermobile joints is a very, very, very bad thing when it comes to instrumentation and can lead to a very short career. So I want every single one of you to stick out your thumb. Now, a normal thumb should look like this. My thumb is like this. You can see that my thumb is hypermobile. See how when I press on my thumb, the joint is popping out? So when I'm instrumenting like this, the joint is popping out of the socket. That is bad. That is very, very bad. That is a short career. And I started experiencing, lots of tenderness, lots of issues with my thumbs. That also has to do with growing up with social media, swiping and scrolling. I don't do that anymore. I use my index finger or I type using my Siri activation. I try to limit the exposure and the movement that I do on my thumb and my fingers. But what happens is as we're instrumenting and we're rolling our instruments and this joint is popping out of its socket, it's damaging. You're causing damage. And it's even on your other joints. Like see how even this joint pops out a little bit? Not a ton, not like my thumb, but definitely noticeable. So it's important to use a dental splint to protect yourself. So what happens is when we instrument, we're fulcruming, we are putting pressure on those joints when we are pressing down and scaling up. And the reason why I like my splint is it takes the beating for me. So this is my thumb when I press down. Now watch, I put this splint on. And just for a reference, this is a size 9 splint. I have big hands, I have big thumbs. You're probably going to be like an 8 or a 7. But watch, look at my thumb now. Straight, it is straight. This right here stops my thumb from hyperextending. So when I instrument now, my thumbs are flat. It is preventing that joint from popping out of the socket, popping and dislocating all the time. They even have small splints that you can even wear on your fingers right here. But my main issue, I'm a right hand dominant person, is my retraction thumb. I'm constantly retracting like this, retracting. This hand doesn't get the beating as much as actually my left hand from pulling, retracting. So I wear a finger splint on this finger and I wear a thumb splint on this finger to keep my joints where I hold my mouth mirror from dislocating. So please use some thumb splints. This is the longevity of your career. On top of it, my hands don't fatigue like they used to. That force is no longer being put on my body. The brace and the splint is taking it. So please go to dailydentalhygiene.com, go to the shopping tab, and I have a variety pack on my website, and I encourage you to buy the variety pack, figure out what sizes you like, and which size is going to be good for you, and then you can individually buy, that size, like a 6, 7, 8 splint or like a 2, 3, 4 splint. So you can figure out which sizes are going to be good for you. But this is so important. So important. I also want to talk about rolling your instrument. This is kind of a side note, but when you roll your instrument, the reason you want to roll it on the tip of your finger, if you roll it at the base, this is going to happen. The popping of the joint out of the socket. When you put your force right here, the joint is safer. So that's why they always say, roll your instrument on the tips of your fingers, roll your instrument on the tips. It's because when you use the base of your thumb, you're putting incorrect pressure on your joints. Whereas if you roll it like this, It's a lot safer ergonomically for your fingers. Take care, guys. Take care of your body. That is the most important thing you can do. Taking care of your body. Try not to text and swipe and scroll with your thumbs. I literally put my 2 fingers together and I'll scroll like this. Or like I said, when I'm texting, I hit the Siri button and I speak whatever I need to say to prevent my, my thumbs and my fingers from taking that beating. Day after day after day, hours and hours and hours of that definitely catches up with you. Take care, guys.